I'm Chief Rob Wiley. After 30 years in the emergency services, the fire department, as a tactical medic, there's one thing I know for sure. Hope is not a plan. You know, many schools and businesses have stop-the-bleed kits just like this one, which are available should an incident occur that requires the immediate application of life-saving bandages or equipment such as a tourniquet. But many people don't know how to properly use what is in these kits in order to effectively save a life. Do you know what's in your stop-the-bleed kit? Do you know how to use it? In this short video, we'll take a closer look at the common life-saving contents of a stop-the-bleed kit and show you how to use our care system to save a life. Let's talk about the care system. This was developed by the First Care Provider Foundation, which is a nonprofit dedicated to teaching non-medical people how to take care of themselves and others in a medical emergency. You'll see that the C, the A, the R, and the E are in very specific locations. It's something you can remember because everybody wants to care for somebody that's injured, especially if it's your friend or your family member or a loved one. Let's break it down. The C in the care system stands for control bleeding. This is first. This is the most important thing you can do, is stop bleeding. Critical bleeding can be described as something you might hear people say that it's a squirting blood or a bright red blood. I'm going to tell you what you need to know. If you see blood and your description of that blood is like, holy cow, that's a lot of blood, they have a problem and you need to stop that bleeding. The best way to stop that bleeding is with direct pressure. Now initially that direct pressure might come from your hand or your elbow or your knee or a finger. Then we can transition to a more permanent solution for that pressure, and that's where our tourniquets come in. So care, the C in care, is all about controlling bleeding. Every drop of blood that leaves someone is a problem and we need to jump on it right away. People can bleed to death from an arterial bleed in as little as 3 to 5 minutes, so it's important that we jump on it quick. The A in our care system stands for airway. Did you know the most common obstruction of the airway in a person is their tongue? Your tongue is a muscle, and if you're laying on your back and you're unconscious, that muscle relaxes and it falls back to the back of your throat and blocks your airway. So it's really important that we get that person up on their side in what we call the recovery position. We'll show you how to do this step by step. This allows gravity to take effect, the tongue to fall forward, and if the person happens to vomit, which injured people often do, the vomit goes out and they don't choke on it. So once we've taken care of the critical bleeding, we can move into that airway step. The R in the care system stands for respiration. Now what we're looking for is the integrity of the respiratory system of the person. And it's as simple as this. I want you to look at that person from their chin to their navel, 360 degrees around, don't forget their armpits, and look for a hole. You can find holes because the clothing is ripped or bloody or jagged, and you'll also see the person acting very sick. They're having a hard time breathing. Believe it or not, your windpipe, your trachea, is only about the size of a quarter, and it only takes a whole 2/3 of that size, somewhere in this chest we'll call the box, for the air to preferentially go in that hole instead of into your windpipe. And if it's going in this hole and not your windpipe, you're not breathing and that person's in trouble. So we need to look for that hole from their chin to their belly button, 360 degrees around, and put a sticker on it. And that sticker in your Stop the Bleed kit is that chest seal. The E in our care acronym stands for exposure. Believe it or not, people even on a hot day, 90 degrees outside, can become sicker as they get cold. As you lose blood and you're injured, your body loses its ability to regulate its temperature. And we now know that as the body gets colder, it loses its ability to form clots, which means you bleed more, which means you get colder, and it's a vicious cycle. We call it the lethal triad. So it's really important to keep people warm, even if that means just moving them from the shade to the sun, putting coats or blankets on or under them and around them. Keep them warm, then their body can help itself. Remember, even on a 90-degree day, that person's body still, its outside temperature is still 10 degrees colder than their body's supposed to be. So just because you're hot doesn't mean they're hot. Keep them warm. Put things on them, over and under them. Let's take a look at the contents of a typical Stop the Bleed kit. A CAT or Combat Application Tourniquet. This is used to control severe bleeding on extremities like arms or legs. We have a compression bandage for injuries that may not require a tourniquet. Also a SWAT-T, which stands for Stretch, Wrap, and Tuck. This can also be used as a tourniquet. There's some security gloves that you can wear to protect yourself from blood and body fluids. Another item you'll find in your Stop the Bleed kit is a rescue blanket. Additionally, we have trauma scissors to help you cut away clothing that may be obscuring an injury for you to see. A chest seal, which is really important if you find a hole anywhere in the person's torso, from their chin to their belly button, 360 degrees around. Rolled gauze can be used for wound packing and to dress a wound. And finally, some hemostatic dressing, which promotes clotting and can be used for wound packing. All right, let's break it down. Remember, the C in our CARE acronym is control bleeding. Let's go to my good friend Dr. David Tan, and he's going to show you how to use the contents of your Stop the Bleed kit to save a life.
One of the easiest ways to control bleeding is by using a commercially produced tourniquet. Now, if you don't have one, then an improvised tourniquet is probably better than nothing, but just know that improvised tourniquets have a higher chance of failure. Not all bleeding will require a tourniquet, and one of the most common questions I often get is, how will I know if a bleed needs a tourniquet? Well, let me put it this way. If you come across a bleeding victim and you exclaim to yourself, wow, that's a lot of blood, and you believe they're bleeding to death, then the use of a tourniquet is probably appropriate. Just remember that the role of the tourniquet is to control bleeding and allow you to use your hands for doing other things like calling 911 or opening an airway or moving them to safety. Many of you may be under the impression that tourniquets are dangerous and something bad might happen if you use one. Well, it won't. Something bad has already happened, and tourniquets are no longer thought of as a last resort intervention. If someone is bleeding to death, a tourniquet should be the first option to control bleeding. If applied properly, you won't make things worse. Applying a tourniquet correctly is simple to learn, and anyone can do it. Let's look at the 4 basic steps to applying a windlass style tourniquet, like the Combat Application Tourniquet or CAT shown here. First, apply the tourniquet high and tight. What I mean by that is place it as high up on the bleeding limb as possible and pull the strap as tight as possible. Second, when pulling the strap tight, it is advantageous to orient the strap and buckle so you're pulling it towards your body, as you can generate much more power and force pulling towards you than pushing away from you. Third, turn the windlass. If you pulled the strap tight enough, then you should only be able to turn the windlass rod 1 or 2 times, 3 at the most. If you're able to turn it more than 3 times, then chances are the strap is not tight enough. And finally, check to make sure there is no pulse in that limb after placing the tourniquet. If bleeding seems to have stopped but there is still a pulse in that affected limb, then another serious medical complication could develop. There are a few teaching points about tourniquet placement that you have to remember. First is that tourniquets hurt, and this does not mean that you've done something wrong or that it's been placed incorrectly. We're compressing good tissue along with injured tissue, and that hurts. Remember, you are applying a tourniquet because you're concerned that they were going to bleed to death. Never loosen a tourniquet, and don't let the patient convince you to stop because it hurts or feels too tight. Because applied properly, a tourniquet will hurt quite a bit. Another type of tourniquet is the stretch, wrap, and tuck tourniquet, or the SWAT-T. Unlike the CAT, the SWAT-T is elastic, sort of like a giant flattened inner tube, and it can be stretched around the limb to provide sufficient compression to stop hemorrhaging. The SWAT-T is ideal for children because windlass tourniquets are often less effective around such small limbs. Wrap the SWAT-T above the wound area or over the wound area if you're using it as a compression dressing. Wrap once around the extremity to ensure the tourniquet is secure against the skin. Pull the SWAT-T tight against the extremity until the graphic diamonds on that tourniquet become squares, and this will indicate that enough tension is being applied to stop severe bleeding. Continue to wrap the SWAT-T around the extremity, maintaining the compression by continuing to pull the tourniquet while wrapping. Once near the end of the tourniquet, hold the last wrap up to create a loop and just tuck the end of the tourniquet under this loop. The SWAT-T will grip onto itself and remain in place. Regardless of the type of tourniquet you apply, be sure to check for continued occlusion or return of a pulse, as loosening can occur after application. Sometimes controlling the bleeding is difficult because of the location of the wound. Tourniquets and pressure dressings work well on the extremities, but are less effective in the junctional region or space between the extremity and the torso. These areas require the use of pressure or wound packing to stop bleeding. Packing a wound is just what it sounds like. The most effective way of controlling bleeding is with our finger, but sometimes we have to apply additional material to maintain pressure on the bleeding vessel. This can be accomplished in a simple 5-step approach. First, you want to identify the source of the bleeding, if at all possible. Next, you'll want to aggressively apply pressure to that bleeding vessel with your finger or your hand. Third, you'll want to fill that space over the vessel with gauze or hemostatic agent to help maintain pressure and compression of that bleeding vessel between your finger and the bone. Fourth, once you fill the space completely, you'll need to apply continuous direct pressure to that wound bed for as long as possible. And of course, finally, you'll want to secure that packing with a pressure dressing of some kind. Now, it sounds intimidating, but we know you can do it. This isn't as hard as it sounds, and your definitive and confident actions can help to save a life.
Thanks, Doc. Remember, if you find somebody that's bleeding, you've got to get direct pressure right away, get that tourniquet out, put it on high and tight. As high in the limb as possible without going over the joint, and as tight as you can possibly get it. If you have someone that's not amenable to a tourniquet, like a junctional wound, that direct pressure is still the answer, using your finger or a fist, and then replace that with gauze, hemostatic gauze if you've got it, to get that pressure right down to where the vessel's bleeding. Direct pressure is always the answer. Let's go to the A in our acronym. A stands for airway, and we talked about the most common obstruction of the airway is the tongue. The tongue is a muscle like any other muscle in your body, and if you become unconscious, that muscle goes lax, and if you're laying on your back, it can fall backwards and block your airway. We're going to show you a very simple maneuver to protect someone's airway who can't protect it themselves because they're semi-conscious or unconscious. We call it the recovery position. In the recovery position, if we find someone who's unconscious on their back, we never leave them in that position. We want to roll them up on their side. And to do that safely and effectively, both for you and the patient, we have a very prescribed way to do it. If you take the person's arm that's away from you and put it up over their head or behind their head, take the person's other arm, lay it across their chest, pull the same leg up into a knee position, get on their hips and roll them up on their side. When we roll the person up on their side, that arm that was behind their head becomes like a kickstand so they don't go all the way over. This gives us a couple of good benefits. Number one, gravity pulls the tongue away from the airway, opening it up. Also, if they vomit, which people that are injured often do, the vomit will go out and not into their lungs and harming their airway. So leaving somebody on their back is a bad option. Always up on the recovery position. If the person's conscious, let them sit however they're comfortable. They'll find the best way for them to breathe freely and easily. Let's go into the R in our CARE acronym, and that stands for the respiratory system. And when I talk about the respiratory system, I'm talking about basically anywhere from your chin to your belly button, 360 degrees around. We call that the box. The problem is if we get a hole in the box, it competes for air with the air that's supposed to be going into your trachea, your windpipe, to help you breathe. So we found a hole somewhere between their chest and their belly button, somewhere 360 degrees around. You take the kit, you open it up, you take your chest seal out, you seal up that hole. You gotta watch them. If they start to look sick again, what I want you to do is check again. You may have missed a hole. So another survey, chin to belly button, 360 degrees around. Don't forget the armpits. It's a common place to miss. If you find another hole, put another seal on it. If you don't have another seal, put anything on it that won't let air go back and forth. Your hand would work great. If they start to still look sick again, we may have a buildup of air in that chest and we may have to let that seal up and let that air escape and then reseal it. The final letter in our CARE acronym is E, and that stands for exposure. What we now know is that keeping people warm is of critical importance. We know that the body can best help itself if it's kept warm. As a person loses blood and they get sicker, they lose their ability to clot. Our job is to keep them warm, to help their body help itself. This can be as simple as moving them from shade to sun, getting them out of wet clothes, covering them up with blankets, with coats, with extra shirts, anything you can find to help them preserve their body heat. Another item you'll find in your Stop the Bleed kit is a rescue blanket. This reflective blanket will help reflect people's body heat back on them and help keep them warm. You can wrap them up just like a baked potato. Remember, even on a hot sunny day when it's 90 degrees outside, that's still almost 10 degrees colder than your body's supposed to be. We've got to keep them warm all the time, even if you're hot. That's it, that's the care system. And now you're familiar with it, and you're familiar with the contents of your Stop the Bleed kit. Remember, C is for controlling bleeding, A is for airway management, R is for respirations, and E is for exposure. Keep people warm. When you or someone you love is hurt, remember to care.